Some of the main reasons people walk in this office here, 90% of the time is because they're in pain. Low back pain, shooting pain into the legs, cervical pain, headaches, things like that. 90% of the time, that's what's going to bring them in the door. 10% of the time, it's people truly looking to make an improvement in their health. Maybe they've seen other doctors and had tests and everything. They haven't gotten anywhere. And as a last resort, they may see a chiropractor to see if we can help, or they've heard that a chiropractor can help someone. Those would be probably the main reasons. We don't use a diversified technique or a Palmer package technique. The techniques that we've developed, these I like to call them Dixon corrective processes that we use here, is a blend of lots of different techniques. We have techniques for older patients that are very non-force, very gentle, easy on their body. And with somebody 70, 80, 90 years old even, less is more. The less we adjust, the better they do, not the more they adjust. And you see some chiropractors on TV or on the internet, and they're adjusting 14, 15, 16 vertebrae in there, and I personally feel that's unnecessary. I would rather focus on 3 or 4 so the brain actually knows what to heal or what to focus on. And we tend to see better results. So techniques, some of the techniques we have here, I love using what's called Schofield functional analysis technique. Non-force drop techniques. We have 3 Pro Adjusters, and Pro Adjuster is a wonderful technique that we use for patients who might be nervous about seeing a chiropractor, that don't like the popping and quote-unquote twisting or cracking of chiropractic. We have all kinds of techniques that work for people. We have an amazing technology from Germany, what's called the Well Wave. We used that just this weekend. My son hurt his elbow, ran the Well Wave on him. 2-3 days later, he's walking around like there's nothing going on. It's fantastic for inflammation, fantastic for sports injuries. We use a lot of kinesio tape, especially with the athletes. Is there one technique I use, or is there any technique I specifically like? I would say no. I think it all depends on the patient in front of me and what we're actually trying to achieve.